Hi, my name is Abby.
I'm Samantha.
And I'm Murphy.
And we did our project on osteomyelitis. The pathophysiology of osteomyelitis is that it is an infection of the bone. This type of infection can develop many ways. Infections can start in the bloodstream, an open fracture, or from surgery. There's two major types of acute osteomyelitis: hematogenous osteomyelitis and direct or contiguous inoculation osteomyelitis. Hematogenous osteomyelitis is caused by bacterial seeding from the blood, and direct or contiguous inoculation osteomyelitis is acquired from direct contact of the tissue and bacteria during trauma or surgery. There's also chronic osteomyelitis that is recurring despite the cause or treatments. It's often caused by a variety of microbial agents, but most commonly Staphylococcus aureus. There's different situations that can occur. An open injury to the bone, such as an open fracture with the bone ends coming out through the skin, can cause this. A minor trauma, which can lead to a blood clot around the bone, and then is a secondary infection from seeding of bacteria. Bacteria in the bloodstream, which is deposited in a focal area of the bone. And then a chronic open wound or soft tissue infection, which can eventually extend down to the bone surface, leading to a direct bone infection. There's a few demographics that are more likely to develop an infection of the bone. It's not something that is genetic or inherited. It's usually caused by bacteria or fungus. As you can see, there are a few risk factors. People with diabetes, immunocompromised like AIDS, alcoholism, chronic steroid use, peripheral artery disease, sickle cell patients, and the elderly. But we focused on intravenous drug use patients because they have a more likely ability to get it due to the fact that they have poor hygiene with using dirty needles and not cleaning their skin properly. Some of the signs and symptoms most commonly seen are fever, irritability, swelling, warmth, redness over the infection area, pain in the area of the infection, fatigue, back pain, which is usually in vertebral osteomyelitis, drainage from an open wound, and loss of range of motion in the affected limb.
So for labs and diagnostics, for labs we're going to be looking at the CBC, looking at specifically the white blood cells. We want to see if there's an infection. We're going to also look at some other markers for inflammation that are usually elevated during an infection, such as the ESR and the CRP. We're going to get a blood culture to determine if there's any foreign organisms in the blood. For diagnostics, X-ray is typically the first diagnostic that is done, but for newer onset osteomyelitis, it might not show on the images. That's why MRIs are recommended to identify the cause of your patient's bone pain or inflammation. CTs are also helpful for later stages of osteomyelitis, and bone biopsies are taken to determine the best course of treatment for the patient. For nursing care, it's obviously going to depend on what kind of osteomyelitis that your patient has, but we did focus specifically on patients who are IV drug users. So for decreased mobility, we want to consult PT to assess the patient's functional level of mobility. We want to use compression stockings or SCDs because the patient obviously is going to have decreased mobility, execute passive and active range of motion. We're going to encourage turn coughing and deep breathing to prevent any complications with the pulmonary system. We're going to evaluate the patient's ability to perform ADLs efficiently and safely, and then fill in where needed if there's any deficits. To assess, we're going to assess input and output ratios for nutritional pattern. For nutrition, it's important for wound care. For healthy adults, daily nutrition requirements are approximately 1.25 to 1.5 grams of protein per kilogram of body weight and 25 to 30 calories per kilogram. Vitamin C and zinc is important for wound healing, so that's going to be implemented into their daily routine. We're going to check for skin integrity since the patient will be spending a lot of time laying down. You'll want to assess for signs and symptoms of redness and tissue ischemia, especially over the ears, shoulders, elbows, sacrum, hips, heels, ankles, and toes. It's important to assist the patient in maintaining their hygiene, and the skin needs to be kept clean, dry, and moisturized. We're going to monitor elimination patterns. Immobility can cause constipation. And then for wound care, obviously we want to look at the appearance, remove any foreign bodies, irrigate, provide a moist but not too wet wound bed, and manage the pain, preferably before any wound care, of course. And then just a couple of extra things for nursing care. We're going to want to provide a safe environment, so bed rails up, bed all the way down. We want to make sure that important items are near the bedside, that way they prevent them from getting up out of the bed. And then assess the emotional response to the disability or limitation as well, because depending on the outcome for the patient could really be a life-changing event in their life. It's a really big deal. And then make the patient as comfortable as possible. So put a pillow under the affected limb, give medications as appropriate, analgesics for pain, stool softeners for constipation, and antibiotic therapy, which is obviously very important, and what I'll be talking about on the next slide. So patients are started on a broad spectrum antibiotic right away. And then once the results come back from the type of bacteria, if the broad spectrum is not the one that they need to be on, they'll get put on the specific antibiotic that targets that bacteria. And some patients are treated with IV antibiotics in the hospital setting or in an outpatient setting, but typically for a patient that is an IV drug abuser, we're going to want to keep them in the hospital setting to ensure compliance of the medical interventions, especially if surgery is needed. Antibiotic treatment can be anywhere from 4 to 6 weeks long.
Some surgical considerations: if the infection does become too severe, surgical intervention is the last line of defense. Depending on the severity of the infection, aspects of surgery may differ. There could be drainage of the infected area multiple times, depending on the presence of an abscess or not. Removal of infected tissue or bone via debridement. Also restoring blood flow to the area. What they will do is remove bone or tissue from another area of the body in order to fill that gap in, depending on where the loss of bone has taken place. And if the patient is not healthy enough for that, they will use a temporary filler until they are healthy enough to use an autograft. Amputation, if infection is caused way too much damage, is extremely rare, but it can occur for recurrent osteomyelitis. And if surgery is needed, it is extremely important to do so to prevent the spread of infection to anywhere else in the body. One more back. For our nutritional principles, healthy foods are going to help you heal. So a healthy diet is going to aid in boosting our immune system. We want to choose low-fat dairy products, which is 1% or skim milk as opposed to whole milk. We want to choose fat-free cheese over the fully fatted cheese. And we also can choose a non-fat plain yogurt also is a good choice. We want to incorporate dry beans into the diet. Chickpeas, lentils, kidney beans, and black beans all have a high concentration of fiber. Lean meats, poultry without skin, as well as ground turkey are good choices. Fish, salmon, albacore, tuna, and trout all have good levels of good fat for us, as well as whole grains, brown rice, wheat bread, oats, and quinoa are going to aid in our immune system. Maintaining a healthy weight will keep the blood pressure lower, which will allow better circulation, which is going to improve our healing time. And if the doctor does permit, we can do some mild exercising and stretching in order to keep the bones and muscles healthy. And we want to make sure that we're incorporating, as Sam said, vitamin C and zinc to improve our wound healing as well. So some teaching and learning needs. One of the main things we want to concentrate on is to make sure that our patient is finishing the entirety of their prescribed medication. Even if they do begin to feel better, they can take acetaminophen due to decreasing their pain and fever, but we want to make sure that they're following the guidelines of not exceeding 4 grams per day and spacing out their doses every 6 hours. For rest and immobilization, we want to be cautious not to injure the area where the infection is present, and to make sure that the patient is using a splint, sling, or brace correctly and provided for the duration of the time that is prescribed for that. Try to avoid any alcohol completely, as well as do not smoke, use e-cigarettes, or smokeless tobacco. And if you currently do smoke, cessation is extremely recommended. And obviously with the antibiotic treatment lasting 4 to 6 weeks and Ken being outpatient, we want to make sure that we're keeping up and following with all of our appointments. When to seek medical attention. If any of the symptoms return, those initial symptoms of back pain, loss of range of motion, any signs and symptoms of infection, redness, swelling, or pain in the infected area, any new drainage or foul odor from the wound, as well as a fever above 100.4, and any increasing fatigue or feeling tired. If we have a patient who is going to continue to inject, we want to educate them on the signs and symptoms of infection. We want to also educate them on safe injection practices of cleaning the skin and also using clean needles and equipment, because these drugs can be contaminated with small particles that can cause these infections. But we also want to educate them on the most effective way to prevent the infection from reoccurring is to stop injecting.
Okay, so we did a pamphlet. It's specifically geared towards IV drug users. It just kind of outlines the different symptoms that they could be having, gives them a little showing of what a bone with osteomyelitis might have, different complications of osteomyelitis such as bone death, inability to walk, loss of limb, and possibly at worst death. It explains what osteomyelitis is and how they would get it. Also, on the back here we have just a little quote that says it's reported that in confiscated injected drugs, 89% were contaminated with disease-causing pathogens, in addition to these pathogens from dirty injection sites and non-sterile equipment, which is a huge factor for IV drug users. Also, it just tells you how to prevent it. If you're not abstaining from IV drug use, then different places that you can go for clean drug use, as well as how to be clean whenever you're using drugs. And then if you're seeking drug abuse treatment, we have a number and address for the Stewart Marchman Act Behavioral Health Services place in Daytona Beach. Yeah.
Thank you very much.
Thank you. Thank you.